Good go. Well, welcome everybody. We're very pleased to put on this important webinar today. I'm Gary Harbison. I'm the Executive Director of the Missouri Coalition for Oral Health. I wanted to note briefly that we've actually worked on this quite a while. Back before the pandemic slowed everything down, we had a work group that looked at this issue of the role of local public health and community water fluoridation. And I bring that up only to let you know that there actually was LPHA representation in that early stage. And then came the pandemic, and we sort of set this aside and have just now gotten back to it. We were, of course, very aware that local public health was a little preoccupied during the pandemic, and we did not think it was a good time to talk about community water fluoridation. So today, your panelists are Ashley Herman, Community Outreach and Project Development Director with the Coalition, Gwen Sullentrup, Community Water Fluoridation and Dental Sealant Coordinator with Missouri Department of Health and Senior Services Office of Dental Health, and Sharon Wisnand. Did I get it right? I don't think I did.
Wisnand,
yeah. I'll get it right one of these days. Anyway, Sharon Wisnand is the administrator with the Randolph County Health Department. And so welcome to you all. Welcome to our panelists. And I am going to turn it over to Ashley.
Thanks, Gary. So today we are going to spend some time talking about the role of local public health in community water fluoridation. This webinar is being recorded and will be available for viewing at a later time. There is continuing education credits available for dental professionals, and more details on that will be shared towards the end of the webinar. With that, we're going to dive into the content for today. So to get us started, a little bit of overview of what we're going to look at today. We're really going to talk about the context of water fluoridation, share a bit of details on the Missouri Office of Dental Health, as well as the Coalition for Oral Health, the role that local public health plays within oral health, dive deep into community water fluoridation, some legislation efforts and anti-fluoridation activities within Missouri, and then provide some specific examples of water fluoridation efforts, as well as some examples, and leave time for questions. This is a webinar, so all questions will be made through the Q&A and the chat box, as attendees are all in a listen-only and muted mode. So oral health is essential to overall health. This is something that has long been established. We know that oral diseases are a devastating problem amongst a significant percentage of Missouri's residents. We know that oral issues affect overall health, as well as their ability to work and learn. Access to oral health care varies greatly across the state of Missouri, and the need for services has been documented in the statewide oral health plan that is housed on the Office of Dental Health's website. So poor oral health has been linked to heart disease, diabetes, stroke, depression, low birth weight, as well as premature births. And oral diseases affect individuals, families, and communities on multiple levels. Poor oral health negatively affects employment status, and that impacts the economic strength of our state. And we know that untreated dental diseases can impact loss of productivity in the workplace. This is from absenteeism, underemployment, as well as unemployment due to the state of a person's oral health. So children with untreated tooth decay not only suffer from pain and infection, they also have issues with eating, with talking, socializing, sleeping. All of these things then can impact their school performance and lower their academic achievement. And finally, lack of access to oral health care within Missouri leads to an increased use of emergency rooms for untreated and unmet dental conditions. So with that said, the state of oral health within Missouri is poor. The Pew Charitable Trust give Missouri a grade of a C for children's oral health and a D for the use of dental sealants. Within Missouri, 64% of Medicaid-enrolled children received no dental care in this past year. And then 44% of our skilled nursing facility residents have been assessed as having untreated dental decay. Among those Missouri seniors ages 65 and over 18% have experienced complete tooth loss compared to a national rate of around 15%. And about 45% of our Missouri adults, so those in the age range of 18 to 64, have lost some, if not all, of their permanent teeth due to decay or gum disease. Within Missouri, about 28% of our population, or a little over 1.7 million Missourians, are currently living within a dental health professional shortage area, meaning that within close proximity to their home, they do not have access to a dental health provider. So Gwen, I'm going to turn it over to you to share a little bit about the Office of Dental Health.
So the Office of Dental Health is housed within the Department of Health and Senior Services under the Division of Community and Public Health. We have 6 full-time employees plus 5 oral health consultants. And we are currently funded with the CDC Cooperative Agreement Grant, MCH, which is Maternal Child Health Grant, and HRSA grants. And then we also receive funding through Delta Dental in Missouri. Our primary areas of activity include working with children's oral health. We have a preventive services program that offers fluoride varnish applications in school settings. And then we also contract with state contractors in various areas around the state. And they go in and actually provide dental sealants as well as other preventive services in schools. We work with community water fluoridation, providing education, technical assistance to operators, and support for anyone that has questions or concerns about fluoridation in their community. We work with adult dental needs, try to improve access to care through our workforce development. And I briefly mentioned the Preventive Services Program. The CDC Cooperative Agreement actually provide school-based sealant programs. They get education, they get oral health supplies, dental sealants, fluoride varnish. In some areas, they're able to do x-rays, dental work that needs to be done, as well as cleanings and then the oral health reviews. The HRSA Workforce Grant, we have several different projects going with that. One, we're working with veterans across with AT Still University, trying to improve veteran status. And then we're also going into nursing homes, providing care in the nursing home setting. We participate with the Delta Dental Student Loan Repayment Grant, the Preventive Health and Health Services Fluoridation Education Activities, and then Delta Dental has awarded us funding to help upgrade or replace water fluoridation equipment or to help purchase equipment for new initiations.
Thanks, Gwen. And we'll talk more about some of those repair and replace as we get going farther into the presentation. So the Missouri Coalition for Oral Health is a 501c3 organization. We are best described as a diverse network of statewide oral health advocates from all areas of Missouri. We have a mission to improve the oral health with all Missourians through sound public policy and a vision of oral health for all Missourians. Our coalition is governed by a 12-member board, and I'd like to note that our vice chair is from a local public health department. So Kelly Volmer from the Jefferson County Health Department serves as our vice chair for the coalition. We are funded through the support of donations, memberships, and grant dollars from the Missouri Foundation for Health, the Healthcare Foundation of Greater Kansas City, as well as the DentaQuest Foundation and the Missouri Department of Health and Senior Services. And all of our information can be found on our website, oralhealthmissouri.org. So with us being an advocacy-focused organization, we do have several policy goals that we work towards in order to strive for better oral health for all Missourians. So just a couple of these to note: expanded coverage of and access to silver diamine fluoride for Missourians, improvement of Mo HealthNet by implementing best practices and system improvements to increase provider participation as well as participant usage, protection and expansion of public water system fluoridation, and expansion of access to dental sealants for children without routine dental care, just a few that I'll highlight. And there's others that you can explore a little bit more at a later time. With that, some of our current activities include hosting an annual oral health policy conference each year in March. We couple this with a legislative awareness event to go in and share with elected officials in the State House the successes of oral health and to advocate for increased opportunities for improving access for all Missourians. And we have an oral health caucus hosted in the legislature with oral health champions to really make sure that oral health needs are front and center. Additional things, we have worked tirelessly to make sure that Medicaid adult dental benefits were reinstated and have been upheld within Missouri, and currently working on increasing access to care for individuals with intellectual and developmental disabilities by bringing dental services to these individuals across the state, utilizing teledentistry and mobile dentistry programs, as well as most recently increased reimbursement for Medicaid dental rates within Missouri. So how does this all play into public health and oral health? Oral health is emphasized by many of our local public health agencies. There are things that a lot of the LPHAs are doing in terms of fluoride varnish. Some have opportunities to provide direct clinical services. There's community education around the importance of oral health, the importance of taking care of your teeth for a lifetime. They have opportunities for connection and assistance for those with special healthcare needs to connect them with dental professionals and to have those working collaborations with the dental providers within their communities and within their counties. Again, we have local public health represented within the coalition at various levels and various stages. We've had participation at our policy conference from local public health officials as presenters, as panelists, and just as attendees. And we know that local public health is working tirelessly on community water fluoridation, and sometimes those do take leadership roles, which we'll highlight as we go today. So a little bit more, Gwen has touched on several of these projects already that local public health works on within the Office of Dental Health. Idea or opportunities such as the WIC agencies providing fluoride varnish to families, those direct dental care opportunities with teledentistry for school-based programs in nursing homes, the dental sealant program to provide sealants within schools, and direct dental care for veterans through the Smiles for Veterans program with A.T. Still University. Other things directly related to the water fluoridation issues that we'll discuss today. Local public health has worked on fluoridation rollback and initiation attempts, education around water fluoridation and around sealants and presentations as requested. So what really is a community water system fluoridation? Where does it come from? How is this being started? And what really is the impact that public health can bring to it? So water fluoridation has been practiced safely in the United States for over 75 years now. And we know that fluoride is a mineral that is naturally occurring across Missouri. A majority of water supplies in Missouri have some level of naturally occurring fluoride. And it may not be an optimal level, but there is fluoride naturally occurring. The United States Public Health Service has set that optimal level of water fluoridation to be 0.7 parts per million, and that is seen to be optimal in order to reduce cavity status. The science behind fluoridation is clear, it's well researched, and it has been present for over 50 years now. And with that research, we have seen that discontinuation of water fluoridation has resulted in increased cavities, and it reaffirms the effectiveness that we have seen within the research. Community water system fluoridation is also an equitable public health intervention. It is supporting the health of all community members. So while most of our individuals might be receiving dental care at least annually or every 6 months like is recommended, we know that there are still members within our communities who do not have access to dental care. And water fluoridation helps to fill the gap to get them some protection from decay in order to keep them at a healthy state. And we also know that many Missourians do not get water from a public water system. There are still several communities and areas that have private wells, and private wells, unfortunately, are unregulated. But you can have all of those tested to see what the naturally occurring levels of fluoride are, and how to move forward towards optimally fluoridating those areas as well. So a few quick facts whenever you're looking at water fluoridation. Community water fluoridation has been touted as one of the 10 best public health interventions of the last century, and that is from the Centers for Disease Control and Prevention. We know that water fluoridation is safe. There is no research that has shown that water fluoridation is hazardous when used at the recommended level of 0.7 parts per million. We know that it is effective. Our research has shown that water fluoridation reduces tooth decay by 25%, even with fluoridated toothpaste and fluoridated mouthwash. So in addition to the toothpaste and mouthwash, we know that water fluoridation helps to reduce those cavity rates by another 25%. We know that water fluoridation is economical. Our studies have shown that for every dollar invested in water fluoridation, it saves around $32 in dental treatment costs. To put that into a little bit bigger perspective, if someone were to have a cavity and have that fixed over the course of a lifetime, that single cavity could cost someone up to about $6,000. So by putting in that $1 of prevention in terms of water fluoridation, you are saving that $32 plus in treatment costs. And then in 2020, we have seen that about 72.7% of the US population is served by a community water system, or over 209 million people have had access to fluoridated water in 2020. So a quote that I will share with you from Vice Admiral Richard Carmona back into the early 2000s, quote, "Community water fluoridation continues to be the most cost-effective, equitable, and safe means to provide protection from tooth decay in a community. A person's income level or ability to receive routine dental care is not a barrier to receiving fluoridation's health benefits. Water fluoridation is a powerful strategy in our efforts to eliminate differences among people, and is consistent with my emphasis on the importance of prevention." So this is from a former Surgeon General who had strong words around fluoridation and wanted to make sure that community water fluoridation was continued and saw as safe and effective across the country. So what does this look like in Missouri in general? So I'll let you take a second and share the map here with you. This is a great graphic that the Office of Dental Health has put together back in March of 2021 that shows the areas marked in blue where natural fluoride occurs across Missouri, kind of there across the central part of the state. And all of the orange dots are showing water systems who supplement their fluoride and optimally fluoridate. So while we have a large portion of the state covered in terms of water fluoridation, there are still opportunities to increase this reach. So what do fluoridation trends look like in Missouri? So a couple of graphs from 2010 to 2020 with the CDC biannual data that is published, we can see that there have been some trends downward in terms of numbers of Missourians being served by fluoridated water. There's also similar trends across the country in looking at the US data. And oftentimes these fluoridation rollbacks are motivated by a cost savings that water operators feel is present. It could be also motivated through activities of anti-fluoridation activists within the community. And generally, it was often discontinued with little or no public input. And that was before a statute was put in place in 2016. And we'll talk about that statute a bit more as we go and why that was so important in helping to stop some of these rollback efforts. So if we continue looking at these trends a bit more, since 2010, we've seen over 70 small Missouri communities discontinue fluoridation. So that is a lot of people being impacted by a reduction in water fluoridation. So with that is a current reduction of population who's adequately having fluoridated water from about 79% in 2010 down to about 72% in 2020. A couple of points to note with water fluoridation battles that were unfortunately lost and resulting in around 32,000 people no longer receiving fluoridated water were Battlefield, Missouri and Houston, Missouri. Clarence Cannon Wholesale Water, Warsaw, and Branson are the most recent fluoridation rollbacks. And we have successfully defended 2 rollback efforts in Festus as well as Park Hills. And I really want to note that local public health were key in both of these communities in the successful defense of stopping those rollbacks. So I mentioned legislation that was passed in 2016 in order to help to combat some of this this work being done. So that was House Bill 1717 and was passed in the 2016 session and went into effect in August of 2016. So this legislation is considered as part of an overall effort to elevate oral health as a policy issue of importance. What this bill did was require notification of water customers 90 days before the community discontinued water fluoridation that they were having conversations around stopping. It also made it to where the water departments have to notify the Missouri Department of Natural Resources as well as the State Department of Health and Senior Services of this fluoridation ending. And finally, it gives an opportunity for community members to defend water fluoridation and to provide sound science and facts for the water department and the community elected officials around, elected officials. So what does the statute actually look like? I'm not going to read it all in full, but that is the statute that is on the books within the state of Missouri, basically saying that any modification to water fluoridation status, the water department shall notify Department of Natural Resources, Department of Health and Senior Services, as well as its customers of its intentions at least 90 days prior to any vote on the matter. And it goes on to share what this notification can look like. So it can be direct mailing in like the water bills. It can be a radio, television article, can be electronic, but it must be notified to the customers 90 days before any form of a vote can be made on water fluoridation. So we're going to transition and talk about some of the rollback attempts and initiation attempts within Missouri. We're going to start with Park Hills. So back in May of 2020, Department of Natural Resources was notified by the Park Hills Water Department that they were wanting to end fluoridation. Whenever the Office of Dental Health was notified of this information, they became in contact with the St. Francis County Health Department, who then helped to organize a task force of local leaders, of dentists, of physicians, school officials, and others with support for water fluoridation to work directly with the city administrator in order to maintain fluoridation. With having that support system in place and that organized task force providing sound information back to the city administrator, the council, and other leaders, they were able to successfully stop that rollback attempt. And the Office of Dental Health was able to provide funding to upgrade and replace outdated fluoridation equipment for the city of Park Hills. And I'm going to pause. Gwen, if there's anything that you would like to add for any of the communities as we're going through them, please feel free to. So from Park Hills, we will roll over to Salisbury, Missouri, which is a similar situation in terms of a rollback attempt. So we were notified in January of 2021 that Salisbury was looking at a rollback. This then led to a task force being created with the Sheridan County Health Department in collaboration with the Office of Dental Health, us here at the coalition, in helping to find some member dentists, physicians, and other local leaders to again provide that sound information back to the elected officials. Salisbury was also successful in stopping this rollback attempt and continues to remain fluoridated. The Office of Dental Health here again offered to fund a repair and replace of any of the equipment that were needed. However, Salisbury did decline those funds, but still maintains their fluoridation status. Moving into Harrisonville, Missouri, another attempted rollback. This one from March of 2022, where the city council considered the removal of fluoridation. Once that was notified, the Cass County Health Department, along with Cass County Community Health Foundation, helped to spearhead efforts to bring that work group together and contact all of the local leaders and elected officials to provide sound science and information on the importance of fluoridation. This rollback attempt was also stopped before it ever started. So before the 90-day notification process was even begun, the task force was able to stop that conversation from happening. Here, the Office of Dental Health was able to provide funding again for replacement of that equipment. And this situation is one where the community truly led the efforts here. Cass County Dental and Cass County Health Department were instrumental in making sure that the importance of water fluoridation was shown for their actual community members with their data and in sharing, what has been seen in the clinic and on the ground to really put, some true numbers to the science and facts that were being shared. If we look towards Lake Winnebago, Missouri, this is from August of 2023 when Department of Natural Resources was contacted about a rollback. Again, that's a very similar set of interested stakeholders from Cass County, and the Cass County Health Foundation reconvened that task force in order to make sure that Lake Winnebago would continue its fluoridation efforts. This is another one that was successful in stopping the rollback attempt, and there was equipment replaced and added so that that system can remain optimally fluoridated. All of that equipment is set to be installed and operational by June of 2024. So I will transition to Clarence Cannon Wholesale Water Commission. So this is a large water commission across the northern part of Missouri. So back in January of 2021, Department of Natural Resources was contacted that Clarence Cannon wanted to initiate fluoridation. So you notice I didn't say rollback this time. This was the first initiation attempt of a new water system in Missouri in over 30 years. So this was very exciting for the task force to be able to work on. So Clarence Cannon is very unique in that it has a water board, county health departments, and 22 local decision-making bodies. So a very large group of individuals that required education around fluoridation, around its safety and effectiveness, and how it impacts public health. So here, the health departments work together along with the FQHCs that were in the area to have those individual conversations with the local decision-making authorities for each one of those 22 counties that were represented. So various levels and multiple points of contact were made throughout this area. And unfortunately, the initiation attempt did die on the table in a tied vote of 11-4 and 11 against without being picked back up. But the fact that an area of that large across the state wanted to look at attempting to initiate fluoridation was a huge win here in Missouri. And I know that these efforts are still being talked about and still being looked at to see how it can be rekindled for the future and see if there can be another push towards initiating fluoridation within those 22 communities again. And then finally, I want to make mention of Camden County, which is the Horseshoe Bend region of the lake area. So back in September of 2022 was whenever notification was made that they were also looking at starting fluoridation for the first time. So here, the water operator and the water board contacted the Camden County Health Department and to see what this process would look like, which then led to that task force organization with the Office of Dental Health. So working collaboratively amongst those individuals, they were able to successfully start fluoridating water in Horseshoe Bend for Camden County Public Water District number 4. Office of Dental Health secured funding for this new purchase of equipment, and it allowed for fluoridation to begin in this community back in August of 2023. So that was a very exciting win for fluoridation within Missouri recently. So what does this all look like in terms of legislation, in terms of public health, and how can we keep this success moving forward? So here in 2024 in our session, House Bill 1621 was filed and introduced by Representative Doyle Justice out of District 41. And this is the Fluoridation in Water Systems Bill. So it was first and second read, but unfortunately did not come out of a committee. So we are seeking new champions to refile that bill for the 2025 session. So the nuts and bolts around House Bill 1620 was it is saying that any water system looking to make a change in fluoridation status must seek sound information on the impacts of public water fluoridation from their local health department. So we know that our local health departments are the experts in public health issues within their areas. So by having local public health being involved in these decision-making processes and making sure that they're providing sound information to the water department and to the other elected officials, this will really help to make sure that good information is being shared and help to combat any anti-fluoridation activity that may be present in an area. So speaking of anti-fluoridation activity, Missouri has long been targeted by anti-fluoridationists. We see that smaller communities are generally the focal point of these activities, especially in areas where distrust from people from outside of that community tends to run high. Anti-fluoridationists tend to run on conspiracy theories, false science, misquoting, misrepresentations, exaggerations of various pieces that may or may not be true, as well as providing contradictory information to the public and to elected officials. The ultimate effort here is to gain doubt within the community. And this is generally a tactic that's seen whenever cases of water fluoridation go to a public vote. They want to try to just get that little grain of doubt to make people think that, well, maybe this isn't quite as great as what these public health officials are saying. Within anti-fluoridationists, we know that civil discussions and debate are not effective. They really want you to try to engage with them to kind of be combative, and we find that that is not the greatest way to communicate here. So local community leaders may allow for that kind of discussion and may see that some of these pseudoscience pieces are actual facts. So how do we combat that? And that's where local public health has the ability to come in and provide sound facts and sound science to be able to raise the true issues with fluoridation within their communities. So we see with fluoridation, there are multiple challenges that exist whenever we're looking at fluoridation as a whole. So generally, there is not a standing source of funding for campaigns to help block anti-fluoridation efforts on a broad scale. And usually your anti-fluoridationists have done their homework on their communities. They understand the local system that's in place. They understand the local officials who are there. And they have a clear plan of action of what they're trying to accomplish. Generally, there is not an organized response immediately available whenever an anti-fluoridationist group come into a community, but that is where local public health can come into play, and in partnership with the Office of Dental Health and with the Missouri Coalition for Oral Health, we can start to put those task forces together in order to help combat some of these issues. This is also a unique spot for local public health because sometimes they are the ones better positioned to drive the bus, so to speak, in terms of the dental professional instead of the dental professionals. So the dental professionals are great in taking care of the health of their community, but generally they see their patients on an individual basis, whereas local public health has a broader community-wide perspective that can be shared. So if we're working towards the issue of water system fluoridation, some things to keep in mind. Every community is unique and every fluoridation conversation is unique. So while I mentioned Clarence Cannon wholesale water earlier in those 22 communities, those were 22 very different conversations with each one of those water districts and water operators. And each one had a different challenge and a different idea of what fluoridation was and what needed to be done in order to make it work. Sometimes local decision-making bodies will ask for public health to be involved, and sometimes they don't want public health involved. So this is why we are looking at that legislation to make it to where local public health is the leading health authority in providing that sound policy or that sound science and facts for water fluoridation. Sometimes the local conditions are not favorable for public health to be involved as well. So this is kind of where public health leadership has to determine their best course of action and how to interface with their leaders within the communities. And generally, we see that some of the communities across Missouri, especially smaller communities, don't always want outside organizations coming into their areas and trying to educate them on the issues happening. So this is where those public health officials within their county, within their jurisdiction, can go in and say, yes, I'm a constituent. Yes, I work within this area. And this is the factual information that I want to provide to you. So support for local public health in terms of fluoridation comes from a variety of levels. So the Office of Dental Health is here to provide consultation and assistance, as well as the factual information on fluoridation. They have several resources and toolkits available that we'll talk about in a little bit that are there for you to utilize. The Missouri Coalition for Oral Health is also prepared to provide that consultation and assistance and to help serve as a connector for individuals working on fluoridation issues. So how can we work with other groups such as the Missouri Dental Association to help find dental professionals within your communities who are willing to go and speak with you on water fluoridation issues? And also, there are several local public health agencies across the state who have worked on fluoridation issues before, and they are always willing to talk with other LPHAs about their experiences and how things went, and really help to provide that framework of talking points that they took into their own communities so that you can have those resources as well. So I mentioned a community water fluoridation toolkit. This was recently developed by the Office of Dental Health with a wide range of resources within it. Some of those include a checklist for water fluoridation program cessation and initiation. So an actual checklist that the water department can go through and say, have we met this, 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 and this in order to look at starting or stopping fluoridation. There is a great fact sheet around stats with Missouri water fluoridation specifically, and a toolkit on how to organize a water fluoridation vote. There are wonderful sample letters of support for water fluoridation that local public health administrators can use as guides to provide testimony and support for continuing or starting water fluoridation within a community. Lots of quick responses to common water fluoridation questions that we have seen across the state. And all of these materials are available to all of the local public health agencies. You'll just contact Gwen over at the Office of Dental Health, and her contact information will be shared at the end of the presentation. So what else can you do in order to look at water fluoridation from a public health perspective? The biggest thing is to talk with your local water department. Go and tour your water department, see what they actually do on a day-to-day basis. You'd be surprised how many people have never had a conversation with a water operator. They don't understand where their water comes from. And until you can understand that, it's hard to have some of these more in-depth conversations. So really go have a conversation, make them your friend. Talk to them about public health initiatives that you already are working on. Share with them your appreciation for having clean water for the community, and ask them, how do you feel about fluoride? And if it's not something that you're looking at doing, what information would help to educate you, or what is your why um, as to starting fluoridation? Make sure that you're always providing them with factual and science-based resources, so that they have the best materials in front of them. And sometimes we see that a lot of the pushback in the smaller communities are actually coming from the water professionals themselves when it comes to water fluoridation. So by having these conversations with them, by getting to know them and understanding the things that they're doing, that can help to build that relationship and potentially stop some of these pushback efforts in these smaller communities. So I mentioned resources that were available for individuals to share and to learn more. A couple that I'll highlight, the American Academy of Pediatrics has a wonderful website called I Like My Teeth, and they do a great job of sharing information in terms of water fluoridation and how that impacts children in their developing teeth. The ADA has several resources around optimal fluoride levels in drinking water, as does the Centers for Disease Control and Prevention. The American Fluoridation Society is one of the best clearinghouses for fluoridation materials that are of sound science that is available. The Office of Dental Health has several resources on their website as well. And here at the Missouri Coalition for Oral Health, we have a webpage dedicated to fluoridation resources also. So I am going to share the stage now with Sharon and let her share a little bit about the experience that she had in working with the Clarence Cannon Water Department. So Sharon, if you want to unmute.
So thank you. Yeah, I have experience working with the Clarence Cannon Water District issue. Initially, we had just gotten an email asking for a letter of support, and of all the things you can do, that's the easiest thing that you can do, because they literally will provide you with a template, and so you can send that back into the state, or I think I even mailed those to a couple of my local water districts personally, just because I wanted them to know how important we felt this issue was. I also talked to my board about it, and we did consider drafting a board resolution about it. Just it's a simple thing you can do. We did it with another issue, not water fluoridation, but we did find that, if someone wanted to know where the health department stood on an issue, then we could provide that resolution that would provide different statistical information as well. But as the Clarence issue went on, Gwen, who was very instrumental in facilitating a lot of things with this. She was going to go to some of our local district and city council meetings and asked if we wanted to be at those meetings as well. And so we did make an attempt to go to them. I think that was really kind of a turning point for our county, because we did attend one of the local water board districts, and Gwen provided a lot of facts and figures, and they were very appreciative of the fact that I took the time to come to that meeting and give my support on this issue and provide feedback too. So there was one, I kind of laughed too, because it's kind of a hurrah story, because I feel like one of these voting members was very anti-fluoridation before, and through Gwen's phenomenal work on this and with us reaching out to them as well, I really feel like that kind of turned him, because he was able to get more of the facts and information that he needed. And just knowing that your input is important to your locals, not just that one member, but we heard from other members as well, as they wanted to know how the health department felt on that issue, and just appreciated the fact that we were providing those letters of support or resolutions or information, or we could provide them with facts and figures on how important fluoridation is. So that's really all I have. It's an ongoing thing, but I'm very happy to have been involved in it. And we weren't successful in getting that vote, but I really feel like we made a huge impact in our community.
Thank you, Sharon, for sharing your experiences, and we'll share your contact information here real quick so that other health department administrators can reach out to you with any questions. And I'm sure you'd be happy to be a resource for anyone looking at fluoridation efforts.
Absolutely.
Yeah, and then I will share my contact information as well as Gwen's, and go ahead and open it up for questions. And again, questions are being handled through the chat and the Q&A functions. Both of them should be at the bottom of your screen. Gwen, do you have any words you'd like to share?
Sure. I just want to let you guys know the Office of Dental Health is always there to support our local public health agencies on any public health issue that we can help on, not just water fluoridation. That is probably one of the more controversial ones. So obtaining accurate material and data and that's been researched and is scientifically sound is very important. And if we can ever come out and help with educating on those materials and things, we're more than happy to do that. I do want to say thank you to Sharon, because she was a great partner in the Clarence Cannon Wholesale Water Commission. And we have been approached by some of the water systems again. So as Ashley had said, it is a continuation, and the Missouri Coalition for Oral Health has always been a great support for us. So we appreciate you guys as well. But if you guys have any questions, please feel free to put them in. We can elaborate more or answer anything you guys have.
And we might even allow you to talk if you'd rather. Is that we don't have just tons of people on here.
If you do want to ask your question live, you can use the raise hand feature and we should be able to unmute you. And while you're thinking of questions, let's see. Chat disabled. Oh goodness. Give us 1 second here. I'm not sure how that got.
That happens sometimes with webinars, but you can certainly use the Q&A.
There we go. That should be back in play. Sorry about that, guys. So while you are having questions added, just a reminder that Dental CE is available for this webinar for those that are interested. There will be a post survey coming out, and I am going to let you unmute. Yeah. Go ahead, Ann, you can ask your question.
I have a quick question. In Pulaski, it's got 2 yellow dots. Is that Leonard Wood? And what is the other town in Pulaski? Does anybody know on the map?
That would probably be, I don't remember if I think it's St. Robert.
St. Robert, okay.
Mm-hmm.
Yeah, I was at the meeting when they canceled it, and it wasn't on the agenda. They walked in and voted on it unanimously to get rid of it. And I was there asking for a farmer's market as a master gardener for the community, and had no idea they were going to get rid of the water. And the mayor wasn't there. Her husband had a severe illness, and it happened in 5 minutes at a meeting.
When was that, Ann?
2014, I believe.
Okay.
In August.
Oh, I was hoping they did it after we got the notification law in place. I mean, because when we could have gone back and ask them to go through that motion again. But
And so I at some point I'd like to work on that for our county. Thank you.
Thank you.
Yeah, thanks. And stories like that are why we went after that notification legislation, so that you can't just have a meeting where it comes up out of the blue and have it voted on right there. We really need that notification period in order to make sure that everyone is well educated on the issue.
Can you all still hear me?
Yes.
Yeah.
I also saw a Dr. Oz show where Aaron Brockovich was talking about how horrible water, fluoridated water was. And I wrote him this hot letter and told him they needed to get a faculty on talking about it. And he had the dean of Harvard Dental School the next day on talking about how Aaron Brockovich was completely wrong. But those films of her videos are still out there for everybody to teach each other how horrible fluoride is. And so I'll send you all the letter that I got back from the Oz show.
that's
Anne- Sorry,
great.
Gary, go ahead.
I'm sorry, I was just saying that's great, enthusiastically.
Yeah, and you'd probably be surprised that her stance on water fluoridation has actually done a complete 180. She's actually an avid supporter now.
Well, I hope they take those videos down then.
And we still have
The
plenty of
law,
time.
the law, while you're thinking about other questions, the law, we modeled that law after a law that had been passed in Tennessee. It did get some modifications as we walked it through the legislative process. One of which was notification with any change. And originally we'd written it only if you were going to discontinue water fluoridation. That got modified at the committee level, which we had to accept. I mean, it's kind of hard to object to that, but that wasn't the point. At that point in time, we wanted to do the law because it was being discontinued in small community after small community. So, but it's still good. I think it's a very good law, and it really helps kind of even the playing field, because these guerrilla war tactics where they go in and get their minds made up before the public even knows it's being talked about, and then do exactly what you saw and just bring it up at a meeting and shoot it down and it's over and done with. That, the law has effectively put an end to that.
It has improved that. I am not seeing any more questions coming in. We still have time for questions if anyone has them. Gwen, myself, the coalition staff, Office of Dental Health, we're all here as a resource for you in water fluoridation. I think we just had a question come in. Definitely impressed by the amount of resources shared. It's interesting that dentists aren't always driving the bus, but they see how public health departments could be much better at communicating the need for fluoride. Yeah, absolutely. There's a place for everyone within water fluoridation questions and conversations.
And even with the sharing of information, you don't have to recreate the wheel. You can just literally share other like Facebook posts, or I know Gwen provided me a lot of stats, and I even did a program and was able to present that information to some clubs and stuff like that. Just because I got in good with those water districts, and now they ask me for information. So there's a lot of ways that you can build those ties in your community.
And I do want to, go ahead, Gary.
Go ahead, Gwen.
I was just going to say, I do want to reiterate, if you have not toured a water plant or been out to visit them, I highly encourage you to do it. They are probably some of the most unsung heroes, in my opinion, because they actually touch more people and can do more in a year's time than what a dentist can do through water fluoridation, and making sure that they're doing that at their optimal levels. So, and what they have to do on a daily basis is astronomical. And many of them wear a lot of hats. They may be your snow plower, they may be your cemetery mower, your wastewater side. So say thank you and go by and visit them.
And they're probably not paid all that well for all of that work too. I was just going to say real quickly, about the comment about kind of what it takes to particularly to push back an effort to stop it. The battle that happened in Colombia several years ago was kind of perfect because a lot of community members got involved in it. And so when the city council had a hearing, there were, I think, 27 people that showed up to support community water fluoridation. And they were dentists and pediatricians and educators and students and other community members. It was a very broad-based thing, and that's important because unfortunately the antis who were there was about 5 of them. They will basically lie about anything, and one of the things they say, it doesn't make any sense, but sometimes it takes hold, is the dentists are in this because they're trying to make money off of it, which is absurd. But that's what they want to do. They want to kind of engage you in a false argument and make you look silly. So when you get that broad-based group, it's really hard for them to kind of keep that foolishness going.
Kathy, I see that your hand is up. You should be able to unmute and ask your question.
I want to say everybody hi. I missed this. I'm sorry I missed the this is important to me because I have a disability and I live in Dustin County. Did anything for disability up here? Dustin County, just I'm gonna say on the map.
Yeah,
Okay.
thank you, Kathy. Absolutely. Water fluoridation touches absolutely everyone and can improve the lives of all of us, and we appreciate you being here. Any other questions that we have coming in? Okay. Okay, well, I think that will conclude today's webinar. This was recorded, and we will get that recording out to everyone who registered. Again, thank you all for attending and for spending some time to learn a little bit more about water fluoridation and how that relates to local public health here in Missouri. And we look forward to talking with everyone again soon. Have a great day.
Thank you.